Welcome to the Deep Dive. Today, we're tackling a topic that often stays in the shadows, especially as we get older. We're talking about sex and intimacy after 70.
Yeah, it's definitely one of those subjects people tend to shy away from.
Exactly. So our mission here is to, pull back the curtain a bit. Gently, but firmly. We've got some really surprising facts and, honestly, super practical insights from a recent chat we had.
That's right, with a leading gynecologist and also a pelvic physical therapist, experts in the field.
And why should you care about this conversation? Well, because understanding this stuff, it can really change how we look at vitality, connection, pleasure, really at any age. It might just spark a really important conversation for you. Okay, so let's start right there. What's the actual picture? For women over 70, when it comes to sex and intimacy, is it just sort of fading out, something we're all supposed to just accept?
Well, unfortunately, that is often the perception. And, for a lot of women over 70, even if they're in a regular relationship, they often just don't bring it up. They've kind of given up in many cases.
Given up, wow.
Yeah, and our experts see two big hurdles again and again. First, there's low libido, and that can affect both partners, of course. And second, physical pain. That could be pain on penetration or sometimes even just during manipulation.
Okay.
But here's the thing, and this is really important. These issues, they're often totally fixable. The real problem isn't biology hitting some wall. It's the silence. It's not asking for help.
Oh.
That's why, the gynecologist we spoke with, her approach is just asking simply, how's it going?
Yeah.
That little question can just open the door. It shows it's okay to talk about this.
That's such a key point. The barrier isn't the body necessarily, but the conversation itself. It really moves it from, oh, well, that's it, to, okay, what's possible?
Exactly. Possibility.
So for those women who do want to explore things, who want to stay sexually active, what are the options? For low libido specifically, our experts laid out quite a few, right?
Oh, absolutely. And it's actually a pretty empowering list when you see it all together. Focusing on women here. Hormone replacement therapy, HRT, that's one possibility.
All right, HRT.
But there's a big but here. If you haven't already been on HRT by age 70, starting it now might not be suitable if you have other health issues. Things like obesity, heart disease, maybe diabetes. You absolutely need a good chat with your OBGYN first. Make sure you're generally healthy.
Makes sense.
Okay, what else?
Then there's DHEA. It's derived from testosterone, something our bodies make naturally. A really low dose, maybe 5 milligrams a day, can give libido a little nudge. And it's seen as relatively safe for older folks, but, it is still a hormone.
Still a hormone, right.
Then you get into specific medications. There's Addyi, a generic, is flibanserin. It's a daily pill. Success rate is around 50%, give or take.
Yep.
It used to have really strict rules about alcohol, like no alcohol at all. That's changed recently. Now you can drink, just not within 2 hours of taking the pill. So a bit more flexible.
That's good to know.
And then there's a newer one, Vyleesi bremelanotide. Our gynecologist called this a particularly effective option.
Oh, interesting. How does that work? It's actually an injectable. But wait, it's like a tiny pen, not a scary needle. Pretty much painless. You do it yourself. You take it, and it works on brain receptors to increase libido within about 4 to 6 hours.
Wow, that's quite specific.
Yeah, it works well for many. The catch can be insurance coverage. It varies. So again, something to discuss with the doctor.
Always the insurance hurdle.
Tell me about it. And then, interestingly, marijuana came up.
Really?
Yeah. For some people, it can increase libido. So if it's legal where you are and you don't have bad side effects, it could be an option. But, and this is crucial, sometimes the answer isn't medical at all. For many women, just getting started is the hard part. If they schedule some romantic time, make the effort to begin, they often find they're perfectly fine once things get going.
So it's overcoming that initial inertia sometimes.
Precisely, that getting in the mood hurdle.
It's really encouraging to hear there's so many different avenues, from hormones to timing things differently.
Absolutely.
But, okay, let's shift gears slightly. Often, right alongside libido, there's the issue of pain. Pain during sex. What did our experts say about tackling that dyspareunia, I think is the term? And how does that tie into maybe difficulties with orgasm too?
Yeah, dyspareunia, painful intercourse. It's a big one. But first, a kind of surprising side note our experts mentioned.
Oh.
Women in nursing homes, they can actually be quite sexually active sometimes.
No kidding. That does challenge stereotypes.
Right. It seems to come down to just having more social interaction, the simple presence of men and women together. It just shows that desire, that need for connection. It doesn't just vanish. It adapts. if the environment allows it.
That's fascinating.
And on a more practical, maybe serious note related to being active, STDs, sexually transmitted diseases.
Ah, yes. Something people might not think about in older populations.
Exactly, especially HPV. The HPV vaccine wasn't around when many women over 70 were younger. So if someone's re-entering the dating world after, say, a long marriage, our gynecologist mentioned she has seen older patients get HPV. So protection and awareness are still really important. Sexual health includes safety.
Good point. Very important.
Thank you.
Okay, so back to the pain itself. What helps?
Okay, so for painful intercourse, several effective routes. If it's relatively mild, maybe especially if a woman has had kids vaginally, sometimes a very low dose of estrogen helps a lot. Like estradiol tablets, just 10 micrograms twice a week, tiny dose.
Yeah, that's generally safe.
Generally, yes.
Yep.
And get this, even some breast cancer survivors can use these very low doses if their oncologist clears it. That's how localized and minimal the dose can be.
Wow, okay. That's significant.
Huge. And then the simplest thing, a good lubricant. Never underestimate the power of lube.
Basics.
Absolutely. There are also newer suppositories, or applying a tiny bit of estrogen cream just to the lower part of the vagina and the opening. That's often where the friction or initial pain starts.
Targeting the entry point.
Exactly. And for women who want or need non-estrogen options, hyaluronic acid suppositories work for some. There's also DHEA, but in a suppository form called Intrarosa. The gynecologist we spoke to was a bit cautious, noting it does eventually convert to estrogen in the body, but some doctors do use it.
So options there too.
Definitely. And now, this is really key. Pelvic physical therapy, PT.
Ah, yes. You mentioned a pelvic PT. What do they do?
It's amazing work. Our pelvic PT explained it so well. They work on musculoskeletal issues, tightness in the pelvic floor muscles. They use manual therapy, teach breathing techniques, sometimes use dilators to gently stretch tissues.
Okay, so physical manipulation and exercises.
Yes, and also neuromuscular control, teaching you how to conjugally contract, then fully relax, and even bear down correctly with your pelvic floor muscles. And often, this also helps with urinary incontinence, which is common in this age group too, so win-win.
That makes so much sense, addressing the actual mechanics.
Totally. She called it the Trifecta approach. You combine the medical side, like maybe the low-dose estrogen, with the musculoskeletal work from PT, and you address any psychological or social factors. That combo gets amazing results.
The trifecta, I like that.
There's also the Mona Lisa laser treatment. You might have heard of it.
Vaguely, yes. It sounds a bit sci-fi.
A little. It uses laser energy on the vaginal tissues. The idea is to kind of rejuvenate them, improve elasticity, help with dryness and discomfort.
Does it work?
It can be helpful, yeah. It's sometimes seen as a bit controversial, maybe over-marketed initially, but it can be a useful tool. Often it works best combined with other things like maybe estrogen or PT rather than just on its own. Needs realistic expectations.
Got it. So it's part of the toolkit, not necessarily a magic bullet.
Exactly. But the big picture here is encouraging. With the right approach, our expert said something like 70% of people can achieve painless intercourse.
70%. That's huge. That's really hopeful.
Isn't it? And then, quickly on orgasm difficulty, similar approaches can help. Topical hormones, a little estrogen or testosterone cream right on the clitoris, can combat dryness and atrophy, improving sensation.
Makes sense.
There are also things called O creams. Some of these actually have ingredients similar to what's in Viagra.
Really? For women?
Yeah, designed to increase blood flow and sensitivity there, specifically to help with arousal and orgasm.
Interesting.
And finally, you might hear about O shots. This is newer, less researched. It involves injecting the patient's own platelet-rich plasma PRP into the area. The aim is tissue regeneration, better sensation. Still needs more study, though.
Okay, wow. That's a really comprehensive look at the physical side. It really does show how much is possible. But it brings up a really important question, doesn't it? Does sex always have to mean penetration? What did the experts say about maybe redefining intimacy as we age?
Oh, absolutely. Vital point. And they stress this. Many, many couples find real satisfaction, deep connection without penetrative sex. And it's crucial to understand that this doesn't necessarily have to be a failure. Not at all.
That feels like a really important message.
It is, and it applies to men too, right? They might find more success or enjoyment with foreplay or other intimate acts. The key, as one expert put it, is having an open mind. Because let's face it, it's a new world after 70, maybe even after 60. Things change.
A new world, yeah.
Adapting. Exactly. And beyond the physical, we can't forget the psychological and social pieces. Sex therapists, couples counseling, these can be incredibly helpful.
Yeah.
Especially if things like depression, anxiety, or just relationship friction are playing a role in low libido.
So looking at the whole picture.
Yes, group therapy exists too, but our experts noted there's a real need for more groups specifically for older adults, a safe space to share these unique experiences.
That makes sense. Creating community around it.
Yeah. And ultimately, what needs to happen is changing the stigma. We have to get the message out there. If you want to be sexually active later in life, it is absolutely possible. Don't just give up on that part of yourself if it's important to you.
But also, maybe permission not to.
Precisely. And equally important, it's okay too if you don't want to be. No pressure either way. But for those who do want it, we need more doctors, more therapists, more practitioners who know about these issues, who ask about them proactively, and who can gently guide people towards solutions. Solutions that can genuinely make life more pleasurable, more fun, more connected.
That feels like the core message. Asking the questions, knowing the options exist. So when we pull all this together, think about the big picture. How does all this help break down that silence, that stigma around sex and aging? What's the main thing we should all take away from this deep dive?
I think it boils down to this. Don't give up. If it matters to you, it's possible. Truly, getting help, whether it's medical, therapeutic, or just talking openly, it can make a relationship so much richer. Even better, maybe. And help it be a happy, long-term one.
Don't give up. It's possible. That's incredibly powerful. So as you think about everything we discussed today, just consider this. What happens when we start openly talking about and addressing sexual health in later life? How could that change not just our own well-being, but our relationships, and even how society views getting older, views vitality itself? Maybe spread the word. Let's keep this important conversation going.